If you're a history buff or survival enthusiast, you're in the right place. Welcome to the Legacy of Survival channel, and make sure to hit that subscribe button, because what we're about to dive into is not just history. It's actionable knowledge you can carry forward today. In World War II, soldiers and medics often faced situations where standard medical supplies were scarce or honestly just non-existent. Yet necessity bred innovation, and many battlefield treatments relied on what we'd now consider ordinary household items. Today, we're going to explore how those improvisations worked, why they mattered, and how the lessons of World War II can still inform emergency preparedness for modern preppers. How soldiers used what was around them to stop bleeding and treat wounds. One of the most pressing challenges on the battlefield was stopping hemorrhages. Medics didn't always have access to sterile gauze or proper bandages, so they had to improvise. Socks, handkerchiefs, and even pieces of torn clothing were used as makeshift dressings. The principle was simple: apply firm pressure to the wound, elevate the injured limb if possible, and secure the cloth tightly enough to control bleeding without cutting off circulation entirely. For modern preppers, this lesson is immediately applicable. You should keep a small roll of clean cloth in your emergency kit, but also, understand that in extreme situations, torn t-shirts or even clean dish towels can serve the same function. The key is applying pressure directly over the wound and securing it firmly. Soldiers often used belts or strips of fabric twisted into makeshift tourniquets. Learning to do this under stress is something you can practice safely at home, especially with guidance from first aid courses. So, how did ordinary kitchen supplies become life-saving antiseptics? Sterilization was another major hurdle, and, in many frontline scenarios, medics had to rely on household items to prevent infection. Alcohol, vinegar, and even saltwater were commonly used to clean wounds when proper antiseptics were unavailable. Alcohol not only disinfected, but also helped reduce the pain in small cuts or abrasions. For someone today preparing for emergencies, understanding the antiseptic properties of common household items can honestly save valuable time before professional medical care is available. Stocking a small bottle of rubbing alcohol, vinegar, or iodine in your prepper kit is simple, but knowing how to use them, soaked on cloths, applied carefully to cuts, and then covered securely, is what, turns these supplies into a real lifesaver. How battlefield improvisation extended beyond bandages to splints and support. Broken bones presented another complex challenge. Medics had to immobilize fractures with whatever they could find. Wooden boards, broomsticks, and even newspapers rolled tightly could function as splints. The technique was consistent. Align the limb as best as possible, secure the splint above and below the fracture, and prevent movement until the patient could reach more comprehensive care. Practically anyone interested in survival medicine can replicate this knowledge. In a non-combat setting, you can experiment safely by learning to make splints from rigid objects around the home or outdoors. Understanding the tension and leverage required to stabilize a limb without causing further injury is exactly the kind of hands-on skill World War II medics honed daily under extreme conditions. how soldiers controlled pain when morphine or modern analgesics were not available. Pain management was another area where improvisation shone. Morphine syrettes were precious and limited, so medics often relied on cold compresses, pressure, and even mental distraction techniques to keep soldiers stable during transport or initial treatment. Ice, snow, or cold water applied to swollen or injured areas reduced inflammation and provided temporary relief. So, modern preppers can, really integrate this knowledge when medical supplies are constrained. Understanding natural methods to reduce pain, control swelling, and prevent shock, such as elevating the injured area, using cold packs, and maintaining calm, can, dramatically improve survival outcomes when professional aid is delayed. You know how small everyday knowledge could mean the difference between life and death. Ultimately, what World War II teaches us is that ingenuity, calm thinking, and resourcefulness can make the difference between life and death. Soldiers and medics didn't wait for perfect supplies. They learned to see every item around them as potentially life-saving. In your home or bug-out location, this mindset is honestly just invaluable. A roll of tape, a sturdy stick, or a clean cloth becomes more than an object. It becomes part of your survival toolkit when you understand its potential. Applying this knowledge isn't about romanticizing hardship. It's about preparing with intention. Practice creating makeshift bandages, splints, and antiseptics in controlled settings, so that if disaster strikes, your hands instinctively know what to do. These are the same principles that kept soldiers alive while waiting for proper medical evacuation during World War II. Every single improvisation, every moment of quick thinking teaches a lesson in practical survival medicine that is still relevant today. If you're serious about prepping, history, and personal readiness, you can't afford to overlook this knowledge. It's not just academic, it's actionable, life-saving, and rooted in real-world necessity. If you found this guide useful, do dive deeper with us by subscribing to Legacy of Survival. Share this video with fellow history enthusiasts and survivalists, because these lessons from the past aren't just stories. They're a blueprint for preparedness that could one day save a life.